Dr. Vicki Peterson here. I wanted to talk to you today about a disease called IBS, or irritable bowel syndrome. If you have this problem, you're in very good company. About 20% of the population in the United States has it. It's the most common diagnosis made by gastroenterologists or doctors that you see for digestive problems. The symptoms are commonly bloating, gas, a lot of digestive pain, a lot of diarrhea. Diarrhea sometimes goes back and forth between constipation and then back to diarrhea again. Usually the diarrhea end of things is more common. These individuals can have bowel movements of loose stools many times a day, up to 15 times a day. Some people having several bowel movements before they even leave the house for work. The patient I'm going to tell you about was actually housebound because of his IBS. If you don't have this problem, but maybe you know someone who does, and that's why you're listening, just imagine anytime you've had food poisoning, or maybe you traveled and got a bug and you had kind of unrelenting diarrhea for a day or so. You know what that feeling is like, where you're really out of control. You don't want to go far from a bathroom. This is how these individuals feel each and every day. And on top of that, they're feeling pretty miserable as far as the pain that goes with it also. Now, in our country, frequently the diagnosis is made that these individuals have depression or anxiety as their main diagnosis, and secondary to that, they're having irritable bowel syndrome. I don't find that to be the case. I find the reverse to be the case, and what I want to talk to you today about is really what to do to normalize that bowel, so not only do you not have those symptoms anymore, but the depression and anxiety that were going along with that are alleviated as well. So to jump right into how we treat this, the number one issue is to look at what you're eating. Now that may seem like kind of a basic concept of if your bowel is irritated, perhaps you should look at what is going into your bowel. But believe it or not, you can get a diagnosis of irritable bowel syndrome from a gastroenterologist and be told it has nothing to do with what you eat, which A, doesn't make sense, and B, I certainly haven't found it to be the case. In my almost 25 years of being in practice, and we are a group clinic here, so there's more than just myself, and honestly, none of us can think of a case of IBS that we haven't handled in a patient that was compliant. So you do need that compliance aspect of things. So number one is to look at food sensitivities. Once again, a food sensitivity is not an allergy. An allergy is a food that you consume, and within an hour you have a dramatic response to that food. Someone eats peanuts and has trouble breathing, or they drink milk and they're running to the bathroom with diarrhea. When it happens that quickly, usually you can figure it out pretty easily, and staying away from the food, of course, is the treatment, and you certainly wouldn't be having IBS because of a food allergy, because you would already know, have made the diagnosis of that association. So food sensitivities, however, have a more delayed response in the body. It's not like eating the piece of bread and then immediately running to the bathroom. That association is not that clear, so people have trouble making that association and need some assistance. It is interesting that gluten and dairy products are the most common foods that we see associated with IBS. Gluten is a protein found in wheat, rye, and barley. And what also is interesting about that is the food that kind of, the comfort food, the foods that we think of to make our bellies happier might be that warm bread, or some pasta, something like that, that has that wheat in it that might be the culprit, and very often we find it to be the culprit of IBS. So the foods that people are told to avoid, like spicy foods and you know, raw vegetables, things like that, they might be aggravating an already inflamed bowel, but I have never found those to be the root cause of the problem. But gluten and dairy, number one and number two, absolutely, we see that regularly. And next, you want to look at the health of the colon from a viewpoint of who's home, as I like to say. So there should be a lot of good bacteria in your intestine. They actually make up 60 to 80% of your immune system. And while we have 10 trillion cells in our body, we have 100 trillion, at least we should have, of these good organisms. So they should be a very robust population to keep that bowel healthy. And if they're not, that needs to be worked on as well. And a laboratory test will look at the good guys as well as the bad guys I'm about to speak about, and that is things like parasites and bacteria and amoebas and yeast, things like that that can overgrow in the intestine and create irritability of those tissues. Also, because you haven't been absorbing your foods as well, eating foods that haven't suited you, having an imbalance of the good guys and the bad guys, you can actually have a deficiency of enzymes in order to digest the foods that you are eating. So that the same lab test actually that we use to determine enough good guys, if there are any bad guys, also looks at the enzymes. So one test kind of handles the majority of those. And then last but not least is some nutrition to help heal the gut. Once you've removed the bad foods, removed any bad guys, given some good guys or the probiotics, things like fish oils can be very soothing to an inflamed bowel. Some people are deficient in zinc because they've had a lot of diarrhea. So those are programs that are tailored to the individual themselves. And I wish I could just reach through and tell you exactly what to do here. But more what I wanted to communicate is that this is a problem that's affecting 1 out of every 5 Americans. And what are they told to do? They're told to avoid spicy food, which I find has nothing to do with it, and they're given antidepressants and anti-anxiety medications that also are not the root cause at all, let alone all the dangerous side effects associated with it. So this program, as I've laid out, is extremely successful, and we've seen so many patients do so well. The individual I was talking to you about earlier was on antidepressants, and the individual that couldn't leave the house was completely housebound. But as soon as we handled, he had a gluten sensitivity, he did have a parasite in his intestine, we did need to improve his diet a bit, he lost weight. All of these things happened, and they had absolutely nothing to do with the medication that he was on that was just kind of barely masking some symptoms. He was still obviously having the unrelenting diarrhea. So he's no longer on the antidepressant, anti-anxiety medications, and he has a new job, which he is very happily driving to, and gets in cars and on planes freely because he's not worried about his IBS because he doesn't have it anymore. So please do share this information. It's very important, and it's really not something we find that isn't extremely able to be handled. So until next time, I wish you very good health.